Hip replacement surgery is reserved for patients who have end-stage degeneration of the hip joint, either due to birth conditions or degenerative changes like osteoarthritis. We also see patients who have femoral neck fractures or who have other conditions like rheumatoid, osteoarthritis, or congenital deformities that require hip replacement surgery. Ongoing hip pain that's due to degeneration of the hip joint. Most patients have pain, mainly in the groin. Anteriorly, there are some pain that occurs on the side of the hip and to some extent on the posterior part, but most of that pain is in the hip joint, in the groin anteriorly. A lot of patients will have symptoms with being able to walk long distances, difficulties with putting on shoes, going up and down stairs, climbing in and out of a car. In terms of hip replacement surgery, there are a multitude of approaches. We have the direct anterior hip replacement approach. There is the lateral approach and the posterior approach. The anterior hip replacement approach goes through a natural muscle plane between two different muscle groups, which allows us to be able to access the hip without cutting those muscles. Compared to a posterior approach, which is through the gluteal, which is the large posterior hip or buttock muscle. The direct anterior goes through this two muscle planes, which provides for easier recovery, less tissue damage, and improved function and recovery. Most patients will qualify for a direct anterior approach. In my medical opinion, I think these are well reserved for most of our patient population. There are very few exceptions to this, but usually the clinical providers can decide what patient would be a perfect candidate. But in my clinical practice, just about most patients will qualify for a direct anterior approach. With the direct anterior hip replacement surgery, this technique allows us to do the surgery with very little damage to the muscle. But most importantly, one of the strong points of this operation is being able to use advanced imaging technique in surgery, mainly computer-generated images and x-rays, to make sure we perform the optimum best operation in terms of putting the components in the most desirable position for optimum outcomes and very limited complication. One important factor of hip replacement surgery is being able to restore the biomechanics of the hips and also making sure patients' leg length are the same or equal when they come out of surgery. And the imaging studies we use during the direct anterior replacement surgery allows us to do this with great accuracy. With the direct anterior hip replacement surgery, the recovery is a lot faster due to the limited muscle damage and soft tissue dissection. Patients are up a lot quicker. They require less pain medication and very limited restrictions in terms of their recovery. These patients usually get up, move around a lot faster, and bounce back a lot sooner. These are the components of hip replacement surgery. And what we have here is a titanium stem. This is the stem that goes in the patient's femur. The stem goes in and the bone grows onto this very rough surface. Once the stem is in, there's a ceramic ball which goes on that stem, and this is the hip component itself. In terms of the hip socket, we have a shell. We mill the hip socket and we put the shell. As you can see, the shell also have some rough coating where the hip bone grows onto, and also holes for supplemental screws. Most importantly, there's a plastic bearing that also locks into the shell, and that makes the socket component. So now when everything comes combined, this is what we call a total hip replacement, and this is the actual implant that we use in surgery. The important thing to note is the plastic lining usually lasts anywhere from 30 to 35 years. The technically well done hip should last in excess of 30-35 years.